You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. We've had him on the program before. He is Florida's go-to dental implant dentist, Dr. Matthew Holtan. Dr. Holtan, welcome to the program. Welcome back.
Thanks for having me back, Randy.
Now, you're one of the busiest guys, like pretty much in the country. I mean, you're very busy, and it's pretty much your practice, I guess, is restricted to implant dentistry for the most part?
Yeah, so as a dental implant specialist, the people that I'm helping are people that obviously have either lost or are about to lose their teeth. In Southwest Florida, due to the age of the population, the need is extreme.
So in Naples, it seems like a very healthy area. Are there that many people with either headed to dentures or currently wearing a denture?
There are. Some of the studies have shown that there's almost 60 million people in America that are wearing a denture. When you have a community like Southwest Florida, there are more people than the average. People that are looking for a solution that maybe didn't even exist when they were going through their problems. And so I find people in their 20s that are looking for new teeth that work, and I've treated people as late as into their mid-90s.
How
that
old?
Are still
You
looking.
can be 90 years old
You can be 90 years
and
old
get new teeth, a whole arch of teeth.
And get new teeth. The procedure is the exact same, no matter what age you are.
What's your oldest patient?
95.
Why would a 95-year-old want to do this?
Randy, if you're 95 years old and you've had great teeth your whole life that work, to transition into some sort of removable denture would be like walking into the orthopedic surgeon with a knee ache and then bringing you a wheelchair. It's just not something that people want to face at that point in their life.
You do a lot of this, and you say some people have seen you on TV. Uh-huh. They watch it, you said 20 times in the green room, but I'm guessing let's say 10 times.
Sure.
And they're still skeptical? Like people tend to put this off?
Don't forget, there's so many different dimensions to the problem, right? People typically are fearful of what might happen. They're also worried about being hurt. And the most important thing is they don't know who to turn to have something like this done. You see lots of kind of misleading advertising about this will work and that will work. In the end, these people have really been failed by dentistry, which is why they're in the situation that they're in.
You think dentures will be gone someday? In your
hope
lifetime?
So. I hope so. I mean,
traditional dentures?
That's what I'm working hard to do. My website is nomordentures.net. I think people have the opportunity to have their lives transformed by getting rid of their removable teeth or getting rid of their bad teeth and having a beautiful smile again.
Okay, good. Now you have a lot of photos.
I have a lot of photos.
So what'd you bring?
So this is probably one of my favorite patients.
All right.
And this is probably one of the most transformational patients I've ever been able to treat. She felt like she was really in the endless cycle of dental procedures. Everything dentistry had ever offered her had failed.
Okay.
She was very skeptical when she first met me. She was afraid of what was going to happen. And if you look at her after, I think the results really speak for themselves.
Wow.
You know, the level of technology that we're able to use to really design her smile, I think is what's most important. And so forget about, losing the bad teeth, forget about, being able to eat again. What really mattered the most to her was really a dynamite smile. Put the pictures next to each other and just look at the side by side.
Okay.
Look at the difference from the before and the after. The first thing you'll notice, obviously, is how the smile really fills her mouth. This is a level.
After, yeah, it looks good.
This is a higher level of detail than we've ever really been able to help people with. We're using new materials. We have digital technology involved in designing the teeth. And again, one of the things I like to look at in some of these photos is look at her eyes before. Right?
Yeah.
She's a little sad, right? She's a little skeptical of me, right? She doesn't really know how this is going to work out. And when you see the after, you see how her eyes just seem to be lit up. I mean, you tell me, does this gal look younger?
She does, yeah. Yeah.
And so I think we really had a wonderful result.
We talked in the green room, and I always think sometimes that you're exaggerating. You go, it really changes their appearance. But this is one of those cases where you become more attractive, whether you're a man or a woman.
Randy, I've been doing this for 10 years, and one of the things that really shocks me as I've become more experienced and helped more people is really not only how it changes their smile, but really how it changes their life. You and I talked about this before we started today. I see people that are doing things that they never thought they'd do again.
Really?
Right?
Like what?
People are going on cruises.
Okay.
They're going out to dinner. They're becoming more social. People are getting new jobs. They're making more friends. And so a lot of people, think that as you get older, you should stop doing that things. And it's really incredible to see people that have changed their life and they're starting to, re-enter the social kind of arena.
Now you say, like, even when they come back for cleanings or follow-up, that they're like, they even act differently.
Absolutely.
Really?
They dress differently. They talk to me differently,
Like their charisma changes?
Everything changes. Everything changes.
So I guess how implants are normally done is you go to one doctor that does the surgery, and another place to even get the imaging, and then you go to another doctor that puts the teeth on top, and you do it all right there. You do both parts.
Right.
So aside from convenience, what's the big benefit there, that you do it all right there?
Well, I think the most important thing is you start with a vision and you end with the vision, right? Okay. People that come to meet me, they want to hear what it's going to be like in the end. They don't really care about, technically how I do it. They really want to see results.
Okay.
And I think I'm the one that's responsible for that. Certainly you know that one of the main advantages of having everything done in one place is typically that we can do it faster. So Randy, what used to take me 8 months now only takes me 2 to 3 visits. Okay, people will always get a new fixed set of teeth in one day. A lot of what I see is people go to these big centers. They'll have their teeth removed, they may have some implants done, but they'll leave with a temporary denture. They may have to wear that for 2 weeks or as long as 3 months. In my office, what I'm able to do for people is let them leave the office at the first visit with a fixed set of teeth. Every time.
So they're always getting fixed teeth.
They're always getting fixed teeth.
That's
That's the only solution that I provide.
How soon can they eat after that?
The same day. We'd like people to be smart about what they eat as they're going through the healing process, but certainly by the time that their permanent teeth are delivered, I think they can eat anything that they want to.
Now, you're a guy. I mean, some people say you're the premier center in Florida for implant dentistry. Does it cost more to go to a guy like you?
It doesn't. Again, we talked about efficiency. If I can provide a more time-efficient service for a patient, then certainly it's going to be more cost-efficient, especially when you think about it, you're not having to pay multiple doctors at multiple locations.
Just one guy?
Just one guy. I'm the only person that you see.
Okay, good. You brought more photos.
I got some more photos. If you look at this before picture, I think it's pretty neat to see, what someone that looks like that's had removable teeth for a long period of time.
That's a denture?
Okay, that's a denture. Those are dentures. The story is always similar to his, is that I had these done a long time ago. They worked for a period of time and they started to fail me. They started to become loose. They started to move when I was talking. I was starting to avoid certain social situations. And if you look here at the after, you can see the results are pretty incredible. And don't forget is that I'm concerned. Obviously, I want the teeth to look beautiful. I want them to look natural. But some people are more concerned about other things. He only cared about function. He wanted teeth that worked.
Eating. He wanted to be able to
eat what he wanted. He wanted his teeth to be in place, and he wanted a permanent, long-term solution. And that's what we were able to provide. I think he got an excellent result.
So what do they like more? The way it looks or the new foods that they could eat?
What's really
or a combination of both?
What's really surprising to me is a lot of the times people are most impressed with what they're able to eat, the level of comfort and the function that they have. And then after a period of time, I see them and they say, you know what, I'm actually happiest I did this to change my appearance, right? I feel different when I go places.
I told you, my father, 85 years old, has an upper and lower, brand new set of teeth, supported by implants. He goes, I don't care how it looks. And now that's all he cares about.
Right.
In fact, he's 85, he thinks young women like him. Yeah. He's playing the trumpet.
I hear that story a lot, Randy. I hear that story.
And he's smiling nonstop.
Yeah, absolutely. I hear it all the time.
And he also said it didn't hurt at all. Right. He exaggerates about almost everything.
Right.
But pain is not really something that they're complaining about?
Well, the important thing is it's a one-day approach. And what that means is almost all the people that we're able to treat, we do it in a single surgical visit. We have anesthesia services in the office so you can relax comfortably, okay? And you and I both know that having something like this done in one time and the results are immediate, right? I've never heard someone come back to me and say they wish they didn't do it because it hurt. Never.
Okay, good. I follow you on Instagram and Facebook, and I mean, you're traveling all over the world learning implant dentistry. You're telling me that you're going to, where are you going next to learn?
And so there's always leading opinion leaders on these things, and they're not all in America, and I'm respectful of that. Some of the most well-respected people in the world are in, Europe and Australia, and if you don't go and hear these people and hear how they're doing it differently, how can you continue to, advance your solutions that you're able to offer to people?
Now you call it digital workflow. Is that what we're talking about?
Why you're able to do it so
fast?
Like anything is with a higher level of technology and more advanced materials. This is not a technician sitting on a bench top and designing these smiles. This is done with computers. We're superimposing images of patients' faces with their digital renderings. I get to show patients what I want them to look like. And so
that's good.
All of those things combined lead to a more durable final solution, and also I think a higher level of artistry that's involved in the final teeth.
Now, look, we've been doing the show for 20 years, and I'm starting to learn now about a few of these things myself, but there's a big trend. The new guys are all doing the snap-in, snap-out dentures. You don't like those?
No, I moved away from that a long time
Why?
ago. Well, you're still giving people a denture, okay? And you and I both know no one was born with teeth that come in and out of your mouth. People want teeth that are fixated. When they go to bed at night, they brush their teeth just like they did when they had their natural teeth. They feel more secure, and I think that they certainly have a better long-term prognosis. So in my office, the primary solution I'm offering is teeth that stay in your mouth. They're more comfortable, and they're more like your natural teeth. Teeth that come in and out of your mouth still have a much, much higher level of maintenance required. The teeth can break still, and I'm finding that it's not a permanent solution, more along a temporary solution. I have so many people that come to me that have had the snap-in, snap-out done, who are looking for a greater level of comfort and appearance that we end up transitioning into a
Is that where you started out, by the way, with the snap-in, snap-out?
Not really. I never really subscribed to it. Really, it was too close of a move from dentures, right?
Okay.
And so people came to me, they were upset about their dentures. The next thing I give them is not going to be another denture, right? These solutions, these fixated solutions have been around for long enough. The research and the technology is there. This is what I went to straight when I started offering these types of solutions.
Very nice. Okay.
This is a gal who really, if you look at her pictures, you can see that her teeth had just failed her. Okay, she was unhappy with the appearance. Okay, she was looking for a better look. She's still a very young woman. Some of the things that I look at when I look at people's teeth, especially, is you can see the teeth have been flattened a little bit. That's a sign.
They're kind of flat.
That's a sign of age, right? The teeth age just like every other part of our body. And so when you're trying to improve on someone's appearance, make them look more youthful, right? When I looked at her, I honestly, I don't think she really had any idea of how much we could change her appearance. Okay, I was really excited, and you can see from her postoperative photos here, we were able to give her longer teeth. They fit her face, and really kind of, as you see when they follow the lip line, really provides her with, I think, an outstanding result. When you show people their new teeth for the first time, you
like in the mirror, you hand them the mirror.
There is a mixed bag of emotions. I've seen people cry. I've seen people, get up and start taking pictures of themselves to send to their relatives.
They're doing selfies right there in the chair.
The important thing really is it's a standardized process with predictable results. Okay, I can show people what I want them to look like before you even start the process, and certainly, changing the color, the length, the size, and the shape of the teeth, as well as how they fit the face, are all kind of important elements in smile design. You see people that get their teeth fixed, and all of a sudden they're out there, they're getting new jobs, right? They're dating again, right? Maybe they're changing who they're dating based on how their teeth look. And so these are things that I see on a daily basis, as part of helping people change their lives. So you hear
stories, like they confide in you, like,
I've
Doc,
heard,
I'm dating again.
I've heard everything. And so you have to be very careful with those situations depending on who you're helping and how. But at the end of the day, what's important to me, obviously, is that you're improving people's lives for the better.
Dr. Holtan, we're going to take a quick break. When we come back, we'll get back to your photos and more about the process. You're watching the Wellness Hour, news that makes you healthier. We'll be right back.
Nobody should be wearing a denture. With a permanent set of teeth, people can now eat the foods they hadn't dreamed of eating in years.
Guess I didn't realize how much I used to put my hand over my mouth. There was absolutely no pain involved whatsoever. I came in, and next thing I knew, I had beautiful teeth. So
I highly recommend. It's the best thing I ever did. There's no pain.
No matter where you live in Southwest Florida, we have 2 locations to treat you. Call us for a free consultation today and get the smile you've always dreamed about.
You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. With us, we have an expert on the topic. He is Florida's dental implant dentist, Dr. Matthew Holtan. Dr. Holtan, welcome back.
Thanks for having me.
So if somebody's watching this, I want a little bit of a timeline. Somebody's watching this, their mouth is a disaster. Bleeding gums, bad breath, loose teeth. They're failing, right? They have gum disease. Next month, they could have a brand new set of teeth.
Absolutely. And the important thing is they have
2 weeks from now, they could have 2.
Absolutely.
If everything works out.
Don't forget, everybody still has options. And so the reason I do free consultations is because I want people to be able to hear from me after I've done the imaging and done an examination what their options are. Not everybody has to have everything treated.
Okay.
If some people have, maybe say 1 arch of teeth that are good, then you can just restore the other arch, with implants.
So
okay?
would you say it's more art or more science when it comes
Randy,
to
I think
creating a smile?
I think it's about 80% art, right, and 20% science. I'm a doctor, right? I went to dental school to learn some of these things, and what I've found is that most of the things that I've learned related to smile design is from working with patients, having them tell you what they want to look like, and especially telling you what they don't want to look like. And it just takes experience and really just sitting down and listening to what people want.
You get hugs from patients, I heard?
Absolutely.
Like nothing else in dentistry do they want to hug you, right?
Yeah. Well,
Except where you say you give them new teeth and they want to hug you. They're compelled.
Especially when they're under the anesthesia, so, but.
Well, good for you. So you have more photos.
I've got some more photos. This is a gentleman, as you can tell, that really had just gone through an endless cycle of kind of dental issues, right? He was a former smoker, right? That obviously negatively impacts your teeth, and was just unhappy with the way his teeth were looking.
So those teeth were bad. I mean, you could not save those teeth.
The teeth were bad. The teeth.
Like he would have ended up in a denture.
That was a potential option. I don't think it was something that was that he ever really thought about. But at the end of the day, we talked about the procedure, we talked about the process, and you can see from the result, he wanted teeth that look natural. Okay, believe it or not, he's actually
looking handsome, looking good.
He's actually getting married soon now. So
okay.
I'm not going to say that I'm the reason he's getting married, but at the end of the day, you see that people's
confidence
lives.
is sexy. I mean, it's good.
Absolutely.
It's attractive.
Absolutely. This is a really, really sweet gal who had been very sick with medical issues.
That's too bad.
Okay, hadn't been able to take care of herself. Okay, and was really at the end of the road with her teeth. Didn't know where to go.
Do you have to make her smile for the photos? Like, are they reluctant even at a dental office where they don't want to show their teeth?
I think people have kind of trained themselves to protect themselves when they're talking. You ever see people that kind of lift a hand up in front of their mouth, right? And let's be honest, they weren't smiling. They had stopped smiling. They had stopped maybe doing things that made them happy, right? Randy, it's kind of hard for me sometimes when I sit with people and I understand their situation. I hear their stories. They've been places that told them they couldn't have this done. They had no confidence left that they were ever going to be able to have their life changed. And I know that I'm going to be able to fix this person's problems, make them look incredible, allow them to eat and chew again, and do it all in one day. Okay, and so I try to relate that to them, but in the end, until they really have the procedure done, they don't really know, and you can see the type of results.
Yeah, it's nice, very nice.
And so these are people that gave up. They gave up on dentistry, right? They lost hope, and
how soon could they eat? I know that you said they have to take it easy,
same
but
day.
before you know it, you could chew through whatever.
The same day. The teeth are fixated to the implants, which are obviously anchored in the gums and bone, and so the day they leave the office, they can go home and eat almost anything they want.
Now patients like this, I mean, did they tell you their food stories? Is it the salads or is it the steak? I mean, what do they like the most?
Everybody's got something
Nuts.
different. Everybody's got something different, and so you hear a lot of people that missed one particular food. The 95-year-old gal that I was able to help wanted to eat raw vegetables.
Okay.
And she knew that she would never be able to do that with removable teeth, right? And so, when she came to see me, the first question she asked, "Can I eat raw vegetables again?" And that's the first time someone said it to me. But obviously she can, and so it's been neat to see her kind of get that back.
Yeah, because when you're older, I mean, everybody's told you have to have fiber, but if you have a denture, I guess good luck chewing.
Well, we all know that having teeth that don't work, right, actually leads to a much poorer diet, a lower level of nutrition, and that affects your health. And so Charles Mayo, the Mayo Clinic, once said that people that have their natural teeth live 10 years longer. And I would kind of extrapolate that to say, if you've got teeth that work, like fixed dental implants, you may live 10 years longer.
Very nice, very nice. Time for a few more.
This is one of my most skeptical patients ever.
Okay.
I think I sat with him maybe 5 times, and he just didn't believe. He'd been other places, they told him it wouldn't work. He'd had lots of dental work done in the past.
So other places are saying it's not going to work.
It wasn't going to happen.
And you're saying it's going to work. He doesn't believe you.
They wanted him to do a denture.
Okay.
And so I showed him photos. I showed him, prior cases that I've treated. And don't forget, Randy, this guy would have ended up in a denture. Okay. And so probably my the best ending to the story is we fixed his teeth, we did the
So
procedure
in one afternoon?
in one day.
Okay.
It went fantastically.
Looks good.
And he was on a cruise, sitting with the captain, and a guy next to him said, "I really like your teeth. They look incredible." And it turns out the guy is a dentist. And so
wow.
even after I fixed him, even after he got the great smile, he was still a little skeptical. You know, this is too good to be true. And only until another dentist told him that his smile was incredible and he was really impressed did he finally come back and tell me, "Okay, I think you did a good job." And so it was kind of neat to hear the story.
That's a nice.
So you can turn a non-believer into a believer.
You know, you mentioned a cruise. You know, people when they plan their retirement don't plan on chewing food on a cruise with a denture. So this is a way, because cruises are about eating, so you can eat whatever you want.
It's certainly not a way to go through life, Randy, at least for a long period of time.
Okay.
This beautiful woman came to me and had been out of dentistry for a long time.
So that's got to be unusual.
It's actually not, Randy. There's lots of people that are out there that have either given up on dentistry, maybe somebody hurt them, right? Maybe they just thought that there wasn't a solution to their problem. And so, you know, when you finally get in and you get to talk to them, again, you know, we talked about this before, is I know what the results will be like. And it's
Like
hard,
you could see it in your mind.
It's hard for me to relate it to them at the visit. But I mean, you tell me, Randy, does this woman look prettier?
Wow.
You know, does she look younger?
It's true.
I mean, it's completely changed, I think, her outlook. When I see her now, she comes to the office, she's dressed, she's beautiful. And so I think there are so many people out there like her that just don't know that there is a solution, that it's as simple as having it done in a single visit, okay? And that they're gonna get a better long-term result than they did out of the old dentistry they had, right? How many people do you know that had a root canal that lasted a year? You know, and so this is a permanent, long-term solution.
So if they take care of it, just like regular teeth, these teeth are going to last as long as they do.
Well, like anything, you know, anything has to be maintained. You know, I want them to see me at least once a year to make sure that they're doing what they need to do. And this is one of the things I think differentiates us from the big guys is that, you know, I have a hygienist. There's somebody in my office that's helping people maintain these teeth, and certainly everybody gets a written warranty that basically reinforces that this is going to work. This is going to last.
Yeah, but if you've been wearing like a denture 10, 20 years, or 10 years for sure, you don't have enough bone to do this. Is that true?
That's not true. And so certainly there are all variations, but one of the things I've found is that part of this newer technological aspect in dentistry is there are more things out now that allow us to provide people with teeth. So just because you had a denture doesn't mean you don't have enough bone. There are people that have had dentures for 50 years that we've been able to treat, okay? At the end of the day, very, very few people are ever not a candidate.
Do patients ever like see the interview that we've done on television and they were told elsewhere, I think you told me this, they're told elsewhere, you don't have enough bone to do this, they come to you and you're able to do it.
It's one of the most common
true?
things. I think I meet somebody every week with
Really?
that same story, that my dentist told me that I couldn't have this done. And so until people come in.
Well, what are you doing that's different than what they were doing?
Well, you know, again, as a dental implant specialist, I just have a lot more experience treating people like this. I'm treating these people every day. I have a 3D cone beam radiographic scanner, which allows me to evaluate people's faces and jaws so that the initial visit, when I see them, I can tell them with 100% confidence if I can help them.
So you haven't really had to turn people away and say, I'm sorry, you don't have enough bone.
You'll always have some people.
Have you had people where you said you can't do anything?
There are always some people out there, and it's usually not because of the bone they have. It's typically because of something they've went through. People that have had extensive head and neck radiation due to cancer, those people are typically not a candidate for dental implants. But again, you know, all I can say is almost everyone that thinks they're not a candidate is a candidate.
And you could be in your 90s and do it.
Absolutely.
And so age doesn't matter.
Age does not matter.
And younger, and because a lot of, you know, younger people, they were taking things that maybe dried out their mouth, they lose their teeth young, like in their 20s. Are you seeing more and more of those people?
Those people are certainly out there. I think one of the things that happened, you know, years ago, and people may talk about stories about their parents or their grandparents, is that in the old days, the one solution was a denture, right? You didn't have options for implants, right? And so there are people that are losing a couple teeth, and you can, you know, add single implants in places to help them. But for the most part, people are unwilling to transition from teeth that stay in their mouth to removable teeth now. It's something that we try to keep people away from. So I think we're helping more people than we ever have.
We have about 2 minutes left. So if a patient goes to see you and they're one of the two categories, their teeth are so bad they all have to be removed, or they're wearing a denture, what are their options for dental implants?
Right. Well, one of the options is obviously to have a few implants placed and have a denture made that snaps in and snaps out. That's not something that I ever promote for people. I don't think it really works. Most of the people that I see in those solutions are looking for something better. Okay. The next solution you'll have is variations of numbers of implants with teeth that stay in their mouth. But the go-to solution for me is 4 to 6 implants in each jaw with teeth that stay in their mouth. They get those teeth the day of the operation. Okay. And that to me is the best in terms of aesthetics, in terms of function, and I think will provide the best long-term solution.
Now, what about the upper denture? Because it has suction.
Right.
Pretty good.
Yeah. Randy, you've obviously never worn a denture because that's probably the most common complaint that I find from people. People want to remove the palate, which has all of the plastic. It covers the taste buds, it makes them gag, makes them talk funny. And so all the solutions we talk about will have the palate completely open, just as if you had your natural teeth.
Do they notice it? I mean, is it a big difference for them as far as taste?
Absolutely. That's one of the first things they tell me is, I feel like I'm tasting all these foods differently.
Especially like wine and things like that, or cold or hot things.
Absolutely. I think it's all involved. Yep.
Okay, final message. We're out of time. Somebody watching this, maybe they've seen you on the program before, and for whatever reason, like a lot of these people, they're putting it off, or they're skeptical, or they're saying, I'm too old. What do you say to them? They're miserable with maybe their denture or their teeth, but they're afraid. Maybe they've been through a lot of pain. Who knows?
If I had to say one thing that people tell me after I talk to them and they finish the procedure, is probably the most common thing is, I wish I did this sooner. Right? People say they're in their 60s, they had these problems since they were in their 50s. They say, I feel like I lost 10 years of my life. 10 years of my life,
okay.
we weren't going to dinners, we weren't being social, we weren't going on cruises or doing things like that. And so, there's no better time now. The procedure is more cost efficient, it's more time efficient. Like I said, there were things I used to do years ago that would take 6 or 8 months, and now we're doing it in 2 to 3 visits.
Okay.
And so there's never been a better time to have something like this done.
Okay, good. So free consultation.
Yep.
Look you up there. I want to thank you for coming on the program.
Thanks for having me.
Always a
Appreciate
pleasure.
it.
Good stuff.
See ya.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.
Nobody should be wearing a denture. With a permanent set of teeth, people can now eat the foods they hadn't dreamed of eating in years.
Guess I didn't realize how much I used to put my hand over my mouth. There was absolutely no pain involved whatsoever. I came in, and next thing I knew, I had beautiful teeth. So
I highly recommend. It's the best thing I ever did. There's no pain.
No matter where you live in Southwest Florida, we have 2 locations to treat you. Call us for a free consultation today and get the smile you've always dreamed about.